Welcome to this presentation on type 2 diabetes. We are registered nurses from California studying to get our bachelor's degree in nursing at Brigham Young University in Idaho. My name is Hazel Allison, and you will also hear from Hillary and Peggy. We hope that you will find this presentation to be helpful and easy to understand. What is type 2 diabetes? Type 2 diabetes is also known as diabetes mellitus type 2. For those of you who don't know what the pancreas is, it is a long, flat gland in our abdomen behind the stomach. The pancreas makes a hormone called insulin that regulates the body's ability to let sugar, also known as glucose, into the body cells to be used for energy. Type 2 diabetes mellitus is a chronic disease that affects how the body uses sugar, which can be caused by a combination of factors, including insulin resistance. The onset of type 2 diabetes occurs when the body cannot produce enough insulin to compromise for the inefficient use of insulin. What happens is that when food is eaten, it is digested in the stomach and the intestines, and it gets broken down into glucose, and then it gets absorbed into the bloodstream. Glucose then moves towards the cells of the body, mainly towards the muscle cells to be used as energy. With diabetes type 2, the glucose is unable to travel to the cells due to insulin resistance. We will talk more about insulin resistance later on in this presentation. We have created for you a brochure specifically on type 2 diabetes. Did you know that in the United States, 30.3 million people have diabetes? 1 out of 4 don't even know they have diabetes. Again, what is type 2 diabetes? Type 2 diabetes mellitus is a chronic disease that affects how body uses glucose, which is caused by a combination of factors including insulin resistance. Insulin resistance is a condition in which the body's muscle, fat, and liver cells do not use insulin effectively. Type 2 diabetes develops when the body can no longer produce enough insulin to compensate for the impaired ability to use insulin. Diabetes increases the risk of developing serious health issues, including stroke, heart attack, blindness, kidney failure, vision loss, and loss of limbs. The signs and symptoms of diabetes are fatigue or tiredness, excessive thirst, frequent urination, blurred vision, numbness or pain in extremities. Extremities are our arms and legs, cold hands or feet, slowed healing, dry mouth, itchy skin, difficulty paying attention, weight loss, acanthosis nigricans, which is the pigmentation of the skin that is shown by areas of dark, velvety discoloration in body folds and creases, and the affected skin can become thickened. Most often, acanthosis nigricans affects the armpits, groin, and neck. Other signs and symptoms are polycystic ovarian syndrome in women and mood issues, irritability, anxiety, and nervousness. Research has shown that structured lifestyle interventions reduces the risk of diabetes by 58%. 84.1 million adults have pre-diabetes. 9 out of 10 don't even know they have pre-diabetes. So there is an epidemic of diabetes in our country. The good thing is diabetes can be prevented, diabetes type 2. It can also be reversible. Ways to prevent diabetes are by exercise, eating healthy, and maintaining healthy weight. Exercise can be done at least 3 times a week, and there are many forms of exercises that we can do to prevent diabetes. Walking, running, jogging, swimming, dancing, playing a sport, just staying active is important. And eating healthy means making healthy choices, such as eating lean protein, eating more vegetables, and eating fruits, drinking lots of water, and hopefully with a combination of exercise and eating a healthy food, we will be able to maintain healthy weight. Now, let's talk about diabetes management. Diabetes is a progressive disease. That means a person who has diabetes can just keep getting worse because of all the complications associated with the disease. It is important for those who have diabetes to work with their doctors or certified diabetes educator to establish a comprehensive care plan to promote adherence. Okay? That means that working with somebody who is specializing in diabetes and know exactly what your health status is, what you like and don't like to do or to eat, working with that individual can help you become successful in sticking to your plan of making a healthy lifestyle change. Okay? And these are some of them we've already discussed, like healthy eating, exercising or having any kind of physical activity, because being active is very important. Taking oral medications. Be sure to take your medications the way it was prescribed by your physician. Daily blood glucose monitoring, whether it be prior to eating, after eating, prior to any kind of physical activity or exercise, or checking your blood sugar at bedtime or as needed for low blood sugar symptoms. Also, you need to stop smoking if you're a smoker, and having good oral hygiene is important. Make sure to take good care of your teeth. Check and monitor your feet for wounds, checking the nerves and blood flow, making sure that the circulation is great or is relatively good. Having annual eye exams, and checking and controlling the blood pressure. These are all affecting your diabetes, your health. Make sure that these are all taken care of if you have diabetes type 2. Now that we have increased your diabetes awareness, let's test your type 2 diabetes skills. Okay, this is going to be fun. You are born with type 2 diabetes. Is that true or false? If you answered false, you are correct. Type 2 diabetes is developed over time. Type 2 diabetes is only a middle-aged and elderly condition. True or false? If you answered false, you are correct. The disease is usually found in middle-aged and older adults, but there is increased diagnosis of type 2 diabetes in adolescents and children. Here is the next question. What is type 2 diabetes? A fatal heart condition. B, insulin resistance. C, all overweight people have it. D, lung issue. If you answered letter B, you are correct. Type 2 diabetes is insulin resistance. As Hazel has stated,
Type 2 diabetes is insulin resistance. As you can see from the picture below, we're able to see kind of a cycle here that obesity, inheritance, and other factors can lead to insulin resistance, causing sugar or glucose in the bloodstream not able to be taken up into the muscles that need that glucose. And there's an insufficient amount of insulin being secreted by the pancreas into the bloodstream. I was once given the comparison of the pancreas like a doorbell. Every time you eat something, your body rings the doorbell for the pancreas. And the more bad things our body eats, the more we're ringing the doorbell on our pancreas. However, over time, our pancreas, the battery on our doorbell, isn't ringing, and the pancreas isn't secreting the sufficient amount of insulin that it needs to bring that glucose into the blood, from the bloodstream into the muscles. So I hope that gives you a good visual picture and idea of what insulin resistance is in your body. Okay, next question. How many Americans are pre-diabetic? A, 84.1 million, B, 84.1 billion, C, 84.1 trillion. The answer is A, 84.1 million Americans are pre-diabetic. And if you remember from the brochure that we went over earlier, it stated that 9 out of 10 people don't know that they're pre-diabetic. Crazy. Alrighty, next question. How many Americans are diagnosed with type 2 diabetes? A, 10.1 million, B, 20.2 million, C, 30.3 million, D, 40.4 million. Remember, this is less than the number that was given earlier on the last slide. The answer is C. 30.3 million people have diabetes. That's 1 out of 4 people do not know that they have diabetes. Scary thought. So here's a fun picture for you guys. This is a picture produced by the CDC, or the Centers of Disease Control and Prevention. They say that 2 out of 5 Americans are expected to develop type 2 diabetes in their lifetime. So if you get a random group of 5 people, 2 of those people are going to have diabetes. Hopefully you're not one of them, and you can take the measures to prevent or control the diabetes. Here we go, question number 6. What are signs and symptoms of type 2 diabetes? A, hot hands and feet. B, weight gain. C, excessive thirst, urination, fatigue. D, increased vision. E, fast wound healing. That would be cool, increased vision, have some laser vision. All right, the answer is C, excessive thirst, urination, and fatigue. If you remember earlier when we talked about that insulin, and not enough insulin is produced for type 2 diabetes, so that sugar stays in our bloodstream, and our body wants to kind of thin out that sugar, get rid of that sugar in the bloodstream. And since we're not able to get the sugar or the glucose into the muscles, our body wants to drink a lot of water to try to decrease that concentration of glucose in our bloodstream, and therefore we're urinating a lot. And also the fatigue comes in because our muscles and our brain aren't getting the glucose it needs from the insulin, allowing it to get into those cells. So our mind and our body just feel so tired because it's not getting the glucose that it needs. So that's why signs and symptoms of type 2 diabetes are excessive thirst, urination, and fatigue. Since we just talked about the signs and symptoms of type 2 diabetes, I wanted to give you more pictures just so you can see to help you really understand those signs and symptoms. So the symptoms are you're always tired. Again, that glucose is not getting to your brain. You're frequently urinating or using the restroom, going number 1 or peeing to try to get that concentration of glucose out of your system. Sudden weight loss. Now, some people might think, really, you lose weight when you're diabetic? It's because, again, that glucose that your body needs is staying in the bloodstream and it's not getting into the cells. Wounds that won't heal. Again, your body needs energy to heal itself. So if the body's not getting the glucose, also that gets converted into energy, it's not going to be able to heal itself. Sexual issues, you're always hungry. Now this is because you feel that your body feels that it's not getting the glucose into this bloodstream, which it's not. So your body feels like, okay, I need to eat. I need to keep eating because I'm not getting the glucose that my body needs. Blurry vision. Those glucose molecules in your bloodstream are pretty big and they can do some damage to your eyes and your kidneys. So that's why it causes the blurry vision. Numbness or tingling in your toes and your feet. Again, the blood glucose, that glucose molecule is not good. It's just staying in your bloodstream and causes damage to your extremities. Always thirsty because your body wants to decrease the concentration of glucose. And vaginal infections. Okay, question number 7. What causes type 2 diabetes, or what are the risk factors of type 2 diabetes? A, poor diet. B, lack of exercise. C, overweight or obesity. D, family history of type 2 diabetes. E, high blood pressure. F, high cholesterol. Or G, gestational diabetes, which is diabetes when you are pregnant. So the answer is not A or B or C, D, E, F, or G, but all of them. All of the answers are above or correct. So causes or risk factors of having type 2 diabetes is a poor diet, lack of exercise, being overweight, obese, having family history of type 2 diabetes, high blood pressure, high cholesterol, and gestational diabetes. Over here in the bottom right corner, you can see from my plate, it shows you how your plate should be proportioned when you eat. That you should have half of your plate be fruits and vegetables and the other half be grain and protein. To have a good balanced diet. So these are all risk factors of diabetes. Okay, another risk factor we didn't talk about earlier is that your race increases your risk of having diabetes, in particular type 2. If you can look at the chart on your screen, you can see that Pacific Islander, Native Americans, Blacks, and Hispanics and multiracial are pretty high up on the list of developing type 2 diabetes. We're not too sure what exactly it is, genetics or race, but that is a risk factor of developing type 2 diabetes, is being Native American, Pacific Islander, Hispanic, and Black or African American.
What are the complications of diabetes? A, stroke. B, heart attack. C, blindness. D, kidney failure. E, loss of limbs, including toes, feet, and legs. F, numbness. G, all of the above. The answer is All of the above. Diabetes is a serious chronic disease with serious consequences and quality of life implications. Type 2 diabetes is the blank leading cause of death. A, fifth leading cause of death. B, seventh leading cause of death. C, ninth leading cause of death. D, 11th leading cause of death. The answer is B, seventh leading cause of death. How do you know if you are pre-diabetic or have type 2 diabetes? A, blood work. B, urine test. C, physical exam. D, eye exam. The best way for pre-diabetes or type 2 diabetes is A, a blood test. A hemoglobin A1C blood test is the best and most reliable way to know if you are pre-diabetic or already have type 2 diabetes. If you have a hemoglobin A1C of less than 5.7%, that is considered normal. A hemoglobin A1C of 5.7 to 6.4% is considered prediabetes. A hemoglobin A1C of greater than 6.5% on two separate tests indicates type 2 diabetes. Can you prevent type 2 diabetes? A, yes. B, no. The answer is yes. Research has shown with lifestyle changes, the risk of type 2 diabetes can decrease by 58% through exercise, eating healthy, and maintaining a healthy weight. What can you change to prevent type 2 diabetes? A, my age. B, my race. C, my lifestyle. D, my family history of type 2 diabetes. The answer is C, my lifestyle. Here are some general recommendations. Get annual blood work and physical. Request a hemoglobin A1C to test for prediabetes and or type 2 diabetes. Exercise 30 minutes per day. Choose an active lifestyle. Choose healthy food options. And maintain a healthy weight. Check out your BMI. Here is a BMI chart. Locate your height and weight to discover what your BMI is. Thank you for your time. We appreciate your attention. Please comment below if you have any questions. These last two slides provide a list of references if you would like additional information. Thank you.